Medical TV, where we bring integrative health to television. It's the Renua Medical Show with your host, Dr. Terry Warren.
Hello, I'm Dr. Terry Warren, your host for Renua Medical TV. And we are so excited today because today we have the medical director for Renua Medical, Dr. Michael Koch. Dr. Koch, thank you for coming.
Thank you for having me. I appreciate it, Terry.
You know, you're the medical director, but tell us a little bit about you.
All right. Well, I'm a chiropractor. I've been practicing for over 30 years. I've been married for 32 years to the same lovely woman. I have 4 children and 6 grandchildren.
So you took seriously what they said, be fruitful and multiply.
That's right, and so did my children.
So, Michael, as a medical director, why Renua Medical?
Well, Renua Medical is really one of the first truly integrated medicine facilities and anti-aging companies in the country. We tried to design a system where we could bring both diagnostics and treatment and nutrition into the same world and sort of a turnkey situation for our doctors and clients.
So Renua Medical is a company that is what you would say cutting edge?
I guess we believe we are, yes.
And what is the focus of Renua Medical as far as you have 2 things that you do. One is a product line and the other is an actual technologies and equipment, correct?
That's correct. We have technology designed for diagnosing or helping to diagnose or analyze a body and the physiology of the body. We have another unit that helps with pain management, wound care, and treatment of neuromusculoskeletal problems. And then we have an entire nutritional line designed to help anti-age a patient, help to make them healthier, help to get rid of certain metabolic disorders that are around and making a patient sick.
So as the medical director, do you mostly interface with doctors or do you interface with medical reps? Do you interface with patients? What is your actual role? What do you do?
Well, actually all of the above.
Oh, really?
I'm on the phone 24/7 just about, it seems like, and I try to field as many questions as possible from our field as we can. Of course, doctors and clinicians get top priority, and our reps need information for them going out to various professionals and other patients. And then those questions that our regular customer service staff can't answer about health care and nutrition and so on come to me. So we are very integrated in that respect, and our staff is extraordinarily knowledgeable about our products and services.
So as the medical director, working in that capacity, do you also do trainings and stuff?
We do. We do a lot of trainings. We have, of course, videotape series. We have slides or PowerPoint presentations. We have manuals that we have created for all the products and services and the equipment. And, of course, the videos. And then those people who need extra help with extra questions, I'm pretty much available all the time.
So the products themselves, which we're going to get to in a minute,
yes.
Would you say that they are state-of-the-art, advanced?
Absolutely state-of-the-art. Some people even call our 3D body analyzer the first Star Trek scanner available. We put Star Trek in quotes. We don't want to step on any toes, but because body scanner, whole body scanners were first introduced in the science fiction arena, our unit really does that on a fairly consistent basis.
So you've been a healthcare professional for almost 40 years, correct?
I hate to admit it, yes.
How has it changed?
Well, certainly we've seen the whole world of holistic healthcare or integrated healthcare. That is the combination of medical doctors and pharmacists and chiropractors and acupuncturists and massage therapists and nutritionists begin to come together and begin thinking on the same, working on the same page and thinking similarly. We found out that each one of those individual practices had its own benefits, and so we find that if we can combine all of those benefits together, the patient is the person that most benefits.
Well, that's what we're all about, right?
That's correct.
Is trying to do that. You know, when I was growing up, they had a saying that an ounce of prevention is better than a pound of cure. Is that true?
Oh, absolutely. Let's face it. It's much easier to detect and treat heart problems before the heart fails. Just like with jet engines, it's better to repair the jet engine before it falls off the plane.
Which is a much better situation.
It's a much better situation, correct.
You know, Michael, in your 30-something years, almost 40 years of experience, what have you found to be one of the biggest problems in the healthcare industry?
Well, I think just what we just spoke about. One of the biggest problems in healthcare is integration instead of compartmentalizing healthcare, that we integrate it all together. And the next big problem would be, of course, nutrition. You know, the problem with obesity in this country is absolutely rampant, and that then generates diabetes and high blood pressure and arthritis, all of those things which cause us to age prematurely. We have the knowledge, we have the intellect, we have the tools to stay younger longer, but unfortunately the nutritional degradation that has gone on in this country is thwarting that and holding us back in that respect.
You know, when I was, I've always believed, you know, there's an old saying, and sometimes, you know, the oldest book in the world is the Bible, and it says that people perish for lack of knowledge. Is Renua Medical about educating people?
Well, my primary goal in life has always been to educate as many people as I can. And in so educating them about health care, we can keep people younger longer and healthier longer. That's my goal in life, and that is Renua Medical's goal in life.
You know, we're going to take a break. We'll be right back. And when we come back, we're going to discuss the products that Renua Medical is introducing into the marketplace. We'll be right back.
Hi, my name's Michael Albuser, and I'm a research professor of medicine. I spent 40 years of my life trying to understand why people with diabetes develop severe problems like eye disease, like neuropathy, why the disease leads to amputations, to kidney failure. I had a dad who died from diabetes because they couldn't control his blood glucose. How many of you have friends or relatives or loved ones who are suffering from the complications of diabetes? Well, over these years, I had the good fortune working in an academic environment to develop brand new technology that can prevent those problems. If you know somebody who has eye problems, then there is a new technology out there for you to tap into. It is called interactive diabetes control, and it will work with you and your healthcare providers and your families in a way that was never perceived of before, that can help you prevent those problems, and in many cases, if they're early, it will help you reverse them. If you're interested in accomplishing these results and in participating in a brand new movement that is called interactive diabetes control, then call the number that you see on the screen. We will work with you to make the biggest difference that there has ever been for you.
Welcome back. We're here with our guest today, Dr. Koch. Dr. Koch, you know, I recently went to and it was very interesting because when I was in India, I was working with some doctors over there that provide products to the hospitals. And they said something to me. They said, you know, in India, we treat people homeopathic first and then allopathic second if there's no other alternative.
Yes.
But I believe that people out there really don't know the difference between homeopathic and allopathic and holistic or traditional. Can you elaborate on that for us?
I'd be happy to. And it's really pretty simple. Homeopathic medicine or natural medicine or healthcare, as we say, really is older than allopathic medicine. Allopathic medicine today refers to standard medical and pharmaceutical drugs and surgery type care, which of course is important for catastrophic illnesses and injuries and car accidents and those kinds of things and surgeries. But holistic health care is really looking at the whole body and treating the whole body at once to keep it younger longer.
Oh, that's an excellent statement. And I agree with that. We need to try to keep people younger longer. You know, I understand that Renua Medical has come out with a very sophisticated line. Tell us about the other product lines that you have and what the purposes of them are.
The other products are, we have a line of enzyme-driven nutraceuticals. Enzymes are the basic building blocks for the regeneration of cells in the body, whether it be a brain cell or a heart cell or a muscle cell. And so, along with vitamins and minerals and other nutritional products, the enzymes are like the glue or the catalyst that makes that cell whole in its creation and healthy. So we have, for example, specific enzyme products for cardiology to help reduce the plaquing and the clogging of the arteries throughout the body. We have a circulation product that does the same, helps increase the circulation into the legs and feet and arms. We have a product for respiration, which allows us to help improve a person's breathing and their allergies and those kinds of things. And we also have another product that is just a systemic product that helps to build up the whole body and make it healthier and stronger and more resistant to disease and so on. Then the last product that we have in that line is for digestion. It makes sense that most of us are eating improperly, and here's the problem. If we eat junk food, our body becomes more hungry because the nutrition isn't there. So even when we eat correctly, even when we eat better, sometimes it simply doesn't get digested correctly. But with the correct digestive enzymes, your body is able to pull all the vitamins, minerals, and nutrition out of the system, out of the food into the system. Now, what the other problem is in today's world, in the United States, is that we eat too much junk food, which we all know, which causes obesity. The other system that most people don't understand is that of growing food today. We grow food that doesn't have the nutrition, the vitamins and minerals that it used to have. So it's even more important to get the total, as much nutrition out of the good food that we eat and get that into the system so that the system has what it needs to rebuild itself.
Yeah, the body rebuilds itself.
Correct.
You know, and, you know, I attended a conference a couple of years back, and it was called the High Economic Impact Corporate America Due to Chronic Disease. Yes. Matter of fact, Governor Wilson was there at the conference, and it was amazing because they determined, after spending a couple of years in doing research and spending millions and millions of dollars, because healthcare costs had gone from 7 to 10% to almost 40% in a matter of just a decade. And it was due to the increase in diabetes, the increase in heart disease, the increase in high blood pressure. And they say that the next generation coming up will even be worse because of juvenile diabetes, etc., and obesity. But they said, after spending millions of dollars, that the root cause of all of these diseases was poor nutrition.
I believe that's absolutely correct. I believe that everywhere in the world now, research points to that very fact. And so if we can eat food that now is organically grown and has more vitamins and minerals in it, and if we can get away from the junk food today in this country and fast food is loaded with carbohydrates. Carbohydrates are, while necessary for in the food chain, they should be lower than some of the other things. Obviously, fruits and vegetables come first, meat and protein products come second, and carbohydrates should come third. In our society today, carbohydrates are the top of the food chain, And so people are getting fat. As they get fat, they develop high blood pressure, obesity, and diabetes. And that is the simple fact as to why this country has so much health problems today.
So would you say that the products that Renua Medical is creating is basically to supplement that lack of nutrients and vitamins that actually were in the foods 40 years ago when everything was grown organically?
That's correct. All of our nutraceuticals are all organically grown. They're free of any toxins, any poisons, any pesticides, any herbicides, and they're completely clean, and that's the most important thing. So what you're not getting from the food that we're consuming, we can now get from these nutraceuticals. And it would be better if we all had all organically grown food, but the truth is we don't. So now, in order to keep us healthier longer, we need nutraceuticals.
That's awesome. You know, we'll be right back. We're going to take another break, and when we come back, we're going to discuss the Star Wars type of technology that Renua Medical has been developing.
My name is Steve Francisco, and I'm the president of Renua Medical. Over the next couple minutes, I'd like to share with you what I believe to be one of the most exciting, one of the most professional career paths in the world today. Also being part of the #1 largest industry in the world, being the medical industry. The medical industry is one of those industries that's not cyclable. It's one of those industries that's never going to go out of style. And today it's the fastest growing industry in the world. You know, one of my mentors used to say to me, to be successful today, you always need to put yourself in that place of most potential. That place of most potential is a company called Renua Medical. We've created a brand new division for medical representatives. You see, this is not a startup company. We basically have a 14-year-old track record of helping people become successful, working with doctors and physicians all around the world to help with their practice. Today, we've taken this brand new division and expanded our focus and expanded our vision to continue through medical representatives, using this as a marketing channel to take everything that we've done in the medical community now into the consumer markets. If you're that type of person that's been looking for the next big thing out there, regardless of your background, if you've come out of the real estate industry, the mortgage banking industry, the insurance industry, no matter what it is that you've been doing out there today, we need you as part of Renua Medical. We have highly demonstratable, very high impact pieces of medical equipment. We have product sciences, and on the back side, we have a financial rewards program that gives our medical representatives the opportunity to have the potential to earn six-figure incomes. We've taken the best of the best concepts from the franchising industry, from corporate America, from traditional business, and put it together. We're that type of company today that needs to think outside the box so we can be competitive. What used to work 5 or 10 years ago doesn't work today. We realize that as a company, and we are destined to become that next giant in this amazing multi-trillion-dollar industry where we see the merging of many different things all coming together with anti-aging, with the wellness industry, all these different industries all coming together under the medical industry, and it's all part of Renua Medical today. Please make sure that you click on the information below to learn more about Renua Medical, or please get back to the person that shared this informational video with you. Thank you very much.
Welcome back. And we're excited to have with us Dr. Michael Koch. Michael, I understand that Renua Medical has really, created some state-of-the-art technology. Some of the technology has been around a little while. They're I guess, what you would call their main product that they built their company on. Tell us a little bit about it, because I understand that it has tremendous benefits.
It does. Our flagship product is called the True Tesla Muscle Stimulator, and it is unlike any other muscle stimulator or electrical stimulator on the market. And I like to say that it's the anti-E-stim unit.
Okay.
Anti-E-stim because the average electrical stimulator is first direct current output, which is DC output, which is the same as a battery puts out. It's low voltage, about 100, 120 volts, and high amperage, 10, 15, 20 milliamps. The problem with that system is that it can in fact burn a patient. It can in fact leave little burn marks if it's turned up too high. That's the standard E-stim. Now, the True Tesla unit is completely opposite. It's AC current, very high voltage, 400 volts, but very low amperage, 4 milliamps. And what that does is it produces a very soft, gentle contraction of the muscle. In the contraction, we increase blood flow 300 to 500%, and in so doing, we increase the oxygen content or flow in the blood 300 to 500%, which actually produces a true healing.
Now, we know that it doesn't cure anything, but obviously there are people that are suffering with certain things, and we've seen that it improves the quality of life for them. What are some of those things that it really has a great benefit for?
Well, any time a practitioner or a patient can increase the circulation into a damaged part, let's say a damaged leg or a damaged arm, bad neck or back, anytime we can increase circulation, we're going to improve the healing. We're going to enhance the healing. We're going to promote the healing. We're going to speed up the healing process. So we're particularly good with things like muscle atrophy, wound care, nerve damage, and pain. Those are the 4 basic categories.
That's excellent. The next piece of equipment, or what I would call Star Wars type technology, and by the way, I have a familiarity with thermal imaging. I work with thermal imaging, and what I was impressed with about thermal imaging is it was able to diagnose breast cancer 5 years prior to what a mammogram would, for example.
Yes.
But I understand that you have a machine that's like basically thermal imaging on steroids. Is that right?
Well, it's actually not thermal imaging. It actually is electroimaging. So
Okay.
It's electrophysiology, kind of like an EKG for the heart, only this is for all of the internal organs, not just the heart. So we look at the heart, we look at the intestines, we look at the stomach, we look at the liver, we even look at brain chemistry and output from, say, thyroid and prostate and those kinds of things. So by using this unit, which we kind of term, as you say, kind of a Star Trek-like technology, we can in 6 minutes do a complete body analysis, and the indicators thereof are indicators of either current problems, illnesses, or pathologies, or something which may be developing. For example, heart disease. You know, 52% of the time, heart disease patients die before they get a symptom. Only 48% of the time does a symptom actually occur, which gives us a warning sign, and then we can treat them. Same thing with diabetes. Diabetes can actually lay dormant in a person or be developing in a person 5, 10, even 15 years before it's actually diagnosed. However, our unit allows us to look at the tendencies that cause diabetes, that create diabetes, and allow us to then get a handle on it or try to treat it holistically, nutritionally, nutraceutically, before it manifests itself.
So this piece of equipment really could help a healthcare professional evaluate and diagnose a patient in the early stages.
Absolutely, and that's the whole idea between modern healthcare. We talked about it before, the difference between old style healthcare and new style healthcare is the ability to try to predict a problem, try to get it, look at it proactively before it happens, and holistically look at things and then get them under control before they get to be a serious problem.
Now, I understand that you have another piece of equipment, and it was created actually for the chiropractic industry, but can be used in other fields as well, physical therapy and other things like that. Tell us a little bit about that piece of equipment.
Well, you're absolutely right. It was actually created by a physical therapist for physical therapists and chiropractors. It's called the Zone RX, and explained simply, almost all doctors and clinicians that treat the neuromusculoskeletal portion of the body, that is the spine and the bones and the pelvis and all that, know that over a period of time, most people with back problems, and by the way, that's a huge number, 60, 65, 70% of the entire profession, of the entire United States will suffer from some type of back problem in their lifetime. And so this unit allows us to untorque the torqued spine and pelvis. We find that the major cause for almost all musculoskeletal, or what we call spinal disorders, and this can be slipped discs and scoliosis and curvature of the spine and so on, almost all of these disorders come from a torquing or a twisting of the pelvis and the resulting twisting all the way up of the spine. Our Zone RX product is the first product on the market that the patient works against. It doesn't work on the patient, to teach the muscles or re-educate the muscles to untwist or untorque, thereby correcting most spinal disorders.
Wow.
Totally amazing.
Michael, we have about a minute left. Tell us what's in the future. We're going to have you back.
Okay.
Because I can see they're developing new technologies all the time. But what does the future hold for Renua Medical?
Well, Renua Medical hopes to get the word out about our nutraceutical products, about our anti-aging products, about our detoxification products, and our abilities to correct both the neuromusculoskeletal problems and the internal problems as well. Our goal is to work with patients and on the whole premise of anti-aging or reversing the aging. You know, most of us baby boomers would like to stay younger longer. We'd like to be viable and creative into our 70s, 80s, and 90s. And the only way that's going to happen is we can reverse some of our bad ways and get into some of the new ways that allow us to stay younger longer.
Well, Michael, thank you for joining us on the show today. You're a wealth of knowledge.
Thank you.
And Renua's lucky to have you as their medical director.
Thank you so much.
And we'll look forward to having you on another show.
I appreciate it. Thank you so much.
Thank you. Thank you for tuning in. And we're going to have more exciting episodes coming up, more exciting shows with incredible guests. So tune in to Renua Medical TV.